very long break, we are finally back with your health program, You're in Your Health on Equinoxe Radio Multimedia. Today, we are going to be looking at a health situation known as monkeypox. The Ministry of Public Health has confirmed 5 new cases of monkeypox in Cameroon. 4 of those cases were detected in the littoral region and 1 in the southwest region of Cameroon. Since the 1st of January 2025, Cameroon has registered 114 suspected cases, with 10 of those cases confirmed. No deaths have so far been registered. Good day, ladies and gentlemen. Thank you so much for joining me on this edition of your favorite health program, You're in Your Health. For presentation, I am Immaculate Fogwe. Let's go on the short break. Thank you so much for staying with us. Tonight, we'll be receiving a Tradi medical practitioner who works at the Padre Pio Hospital. He goes by the name Dr. MUVALA Marcel. Good day. It's a pleasure having you on the program today.
Thank you so much, madam. It's also my pleasure to be part of the program here this evening.
Exactly. Today, we are talking about a public health concern, monkeypox, and it's coming at a time when 4 cases have been detected in the littoral region where we are currently based. Can you tell us more about typical symptoms of monkeypox and how it differs from chickenpox and also smallpox?
Okay, when somebody is infected or come in contact with the germs, it is actually a viral infection, and it will take quite some time for the clinical manifestation. But the main signs and symptoms after the incubation period, the patient will be experiencing fever, there will be headache, nausea, general body weakness, and then general rash. That means that there will be rashes on the body of the patient. Most of those rashes, they appear like a kind of blister that with time would burst and then water will pour out, and the blister is very, very contagious. That is the reason why one of the mode of transmission is direct contact with the patient. So when the blister bursts and release the virus, if you come in contact with the virus or you come in contact with the patient, you will easily pick the virus. And then as the infection progresses, the rash can actually burst and leave deep wound on the surface of the body of the patient. That is very painful. It's a very painful experience to the patient, and if care is not taken, other vital organs of the patient can also be involved. It is true that we have recorded few cases of death because there is a vaccine and there is also medical care for those who are victims. But it is a virus that if care is not taken, it can actually take the life of the patient without any delay.
You have rightly said that monkeypox is transmissible, but then how did the first person who got monkeypox came about with this disease?
Yes, when you hear the name monkeypox, when people get that name, they think that it is a disease of the monkey. Yes, it is also true that monkey can transmit the infection to human, but other bush animal, rodent, monkey, and the rest harbor the germs, and some of them they don't really suffer from the infection. But once man come in contact, you can pick the germ easily. Now, this infection actually came into the community of human from animal, bush animal. When you get bush animal and you don't cook it well, or you come in contact with bush animal, and then the virus enter into the human system, it start manifesting. And once one person is already infected in the community, there's high risk that others can pick the infection because it is a contagious infection.
As you rightly said, we have had several cases already. We are talking about 4 confirmed cases in the littoral region and 1 confirmed case in the southwest region and several suspected cases since the year 2025. Is there a need for Cameroonians to be worried at this point in time?
There is actually a need for us to be worried because when you look in the mid-December 2025, 14 suspected cases was also reported in Cameroon, and this is early January 2026, and we are already having up to 5 reported cases, not even suspected cases, but confirmed cases. It means that there are still many that are harboring the germs and they are not yet manifesting. So the population is actually at high risk. And then one thing we have to understand here is that it is also a droplet infection. It means that when somebody catch the infection, even cough, catarrh, you blow the catarrh and throw it everywhere, you cough and release the virus, then just contact. And even though it is not a sexually transmitted infection, but many cases has also been reported as a result of unsafe sexual practices. So sex workers are also at very high risk, and they are also serving as a vehicle of transmitting this infection. I think that if you have up to this number in Cameroon within this very short period of time, then there is need for Cameroonians to take it as something that is really of concern.
Doctor, for someone who feels that they have been exposed to monkeypox, what's the next step to take?
Yes, once you know that you are exposed to the virus, the first thing to do is to go for vaccination, because the incubation period actually take a longer period of time. So it can take even 1 to 2 weeks in some individual, and even up to 3 weeks. We remember that when the virus enter into the system, and not only monkeypox, any other viral infection, once the virus is in the system, the immunity start fighting it, and those with strong immunity can harbor the genes for quite a long time before manifesting. But once you know that you have come in contact with somebody that is already a victim, the first thing to do is to go for your vaccination. That's the good thing about the monkeypox virus, because even when you are exposed, vaccine can still stop you from manifesting or developing the illness. So once you go and you are vaccinated, you are sure that you have at least taken the first step, which is the most important, and then you still continue with the preventive measure. Don't expose also some of your family members at that early phase, because some people can harbor it and they are not yet manifesting, but they can pass the virus to the next person. So the first thing is to go for the vaccination.
And where is this vaccination done?
Yes, vaccination in all the herd unit, you can have access to it. And even if you go to any herd, especially where vaccines are administered, and you don't have the vaccine, then they will educate you, or they will highlight you on how to get the vaccine. The one thing we have to know here about the vaccine for monkeypox is that the vaccine for smallpox also protect people from the monkeypox virus. But the thing is that once you are vaccinated for the smallpox, you need to go for the second dose, because even those who are not yet vaccinated, the monkeypox virus is in 2 doses. You have the first dose that is administered, like the Genius vaccine. When that one is administered, the first dose is given, and then 1 week after, the second dose is administered. And if you take only 1 dose, then you are not fully protected.
How can we differentiate between monkeypox, smallpox, and chickenpox?
Yes, like I said earlier, when you look at their clinical manifestation, you might think that they are the same viral infection. It is true that they are all viral infection, but they have some differences. Smallpox is closely related to monkeypox, even with the clinical manifestation. But monkeypox is actually very different from chickenpox. First, even though they all form skin rashes, but the rash in monkeypox is deep. It forms deep wound, and it's also very painful. It's a painful rash. But in the rash for chickenpox, you see that the rash is actually superficial, and it is not painful, but very itching. It is very, very itching. You find most patients with chickenpox scratching their body here and there. But those with monkeypox do not actually scratch their body, because they even feel a lot of discomfort, especially when their body is touched, because of pain and discomfort. And then secondly, even though they are all viral infection, but they fall under different classes. You will see that the monkeypox virus is actually different from the virus that causes smallpox, and also different from the virus that also causes chickenpox. But like I said earlier, these infections are similar, especially in clinical manifestation. Like they all produce flu-like symptoms like catarrh, cough, general body weakness, headache, fever, and so on. So once you have those signs and symptoms, the most important thing to do is to go to the hospital, where a precise diagnosis will be done, and they will be able to know whether it is the monkeypox or something else.
Doctor, for someone who has a family member who's currently suffering with monkeypox, how can I prevent myself from being infected? Like, what are the preventive measures I need to take in order to prevent myself from having that disease? Okay,
the one thing we have to understand about monkeypox is that there's a lot of stigmatization, and then also that we understand when somebody is already manifesting with the skin rash and people are running away from the patient. That is not the best to do at that moment. But first, once you realize that you have a family member that is sick, go for your vaccine. But then we try to isolate the patient. It's always good to isolate the patient, because most patients even recover without the treatment. if they are isolated, just within 2 weeks, you see them recovering from the rashes, they are healing and they are recovering gradually. Because once somebody is already a victim, vaccine cannot help. But what we usually do, even in the hospital, is we treat the clinical signs and symptoms, the symptoms that are disturbing, like the fever and the rest. We treat that, and then understand that to handle or to take care of a victim that is already manifesting, we need to practice hygiene. Don't share towel with the patient. Then wash your hand frequently, especially when you come in contact with the patient. Then even dresses. Don't share your dresses with somebody that is already confirmed as a case. Then another important thing here, like I said earlier, is that people should learn to practice safe sex, because even though it is not a sexually transmitted infection, but once the virus enters into the system, it is found in most of the body secretion. So even saliva, you kiss somebody that is having the virus, you can easily pick it. And then if you have direct sexual intercourse with somebody that is also a victim, then you know that you are also exposing yourself to the infection. But in all, what is very important here is hygiene. Personal hygiene, and then hygiene of the patient is very important in taking care of your victim or a family member that is a victim of the virus.
For those who like to participate in today's edition of the program You and Your Health, here are the numbers: 670-54-7049. I repeat, 670-54-7049 or 656-622222. 656-622222. Those are the numbers you can call to participate, or why not ask your questions as far as monkeypox is concerned. Back to you, Dr. Muvala. We want to know, what's the current risk level of monkeypox in Cameroon, particularly in the Littoral region at the moment?
Yes, we already said this. You know that the number of cases is gradually increasing with time. So, but it is true that the Minister of Public Health is actually fighting against this infection. But when you look at Douala in particular, you see that the population is increasing at an alarming rate. So this increase in population means that once we have one person that is having the infection, there's a high risk that many can catch the infection. That's first. And then the sanitation here in Douala is not the best. We know that one of the preventive measures is sanitation. So we see that because of the high population, people are not actually really practicing the good sanitation. So and then sensitization too is also going to be one of the factors, because when you look at, as we are talking today about this monkeypox, many people are hearing it for the very first time. Some people are not even aware that there's something that is existing like that.
Yeah.
And it's killing a lot of people. People are dying silently. So we have to sensitize the public, because many people are not aware and they are exposing themselves to the infection. So education is also going to play a very vital and important role. And then secondly, when you look at the population in Douala, you see that we have people that are from different tribes and things like that. There are some people that believe that if you isolate their patient, then their patient is not receiving the care from the family. So that is, we are still coming back to education. People should understand that if a family member is sick, then that family member needs to be isolated, and the patient should accept his or her situation and accept that isolation for the safety of the family. So Douala is a very big city, and we see that if one person actually is having the infection in Douala, if care is not taken, that infection can really be alarming in Cameroon.
Are there any myths or, let's say, misconceptions you would like to address as far as monkeypox is concerned?
Yes, many people, when they hear of monkeypox, some people think that it is the infection of the monkey, and if you say that the patient is suffering from monkeypox, they say that no, it can't be possible. That infection is supposed to be the infection of monkey. So but we understand that if other animals, bush animals, they harbor some germs, if you don't prepare it well, you can easily catch the virus. And then secondly, people were thinking at first that this virus was created in the lab and then released into the population, maybe for some economic reason or whatsoever. But just like when COVID-19 came up, many people were not believing that actually it was existing, because they thought that it was something that has been fabricated somewhere. So we want to maybe clear this misconception about monkeypox. It was not actually created in the lab, but it was an infection that was actually in bush animal. But because people go for hunting, they hunt bush animal and they bring it into the community. The virus gradually enters into the community, and that's how man became victim of the infection.
Now, talking about infections from animals, how different is this type of infection from Ebola, which was equally announced that it came from animals?
Yes, the issue here is that there are some of these germs that actually can live in the animal and it doesn't cause any sickness in the animal. But when they enter into the human system, it becomes a problem. The one thing I always like to say about nature is that when you look at the way the animal in the bush they feed on nature, they feed on grass, they don't eat artificial food like we. So they have very strong immunity. Okay. So these germs can actually be in the animal and it is checked because they have strong immunity. But once it is sent into the weak human community where we are living with artificial food and we are developing weak immunity, they start manifesting in us. And the animal in the bush that has actually given us the virus, they are not suffering from the infection, but because of our weak immunity, we become the victim.
Now, what measures are being taken by the Ministry of Public Health to contain the spread of this disease at the moment?
Yes, the minister is not actually sleeping in the fight against this because in 2025, that is December 2025, when the minister actually reported 14 suspected cases in Cameroon. Those were not actually confirmed cases, but it means that the government is not sleeping. They were actually working. That was the reason why they could actually rule out those suspected cases. Yes, and also there's a system has actually been set. You see that the Minister of Public Health under the canopy of Minister Ante, all the health district are already alert that there is something existing like that in the community, and in case or any suspected cases is reported to them and the case is forwarded to the system concerned so that measures can be taken to keep it under check.
What advice do you have for Cameroonians watching you, and why not for equally victims of monkeypox? What do you have to tell them?
Yes, what I have to say here is that, like I said earlier, we understand that there are so many, not only the monkeypox virus, there are many viral infections that enter into the system. Sometimes the clinical manifestation might not really be very pronounced and people will be taking it for granted. But once you feel like you are not well, once you feel that there's something that is not actually working well as far as your system is concerned, there's always need to seek medical advice. And then one important thing that we have to understand here is that they're saying that prevention is better than cure. So don't wait to be a victim. When we talk about vaccination, people should go for the vaccine. Don't wait that a family member should be a victim first because the victim might be you. Before you are thinking that the family member should be diagnosed before you go for the vaccine. So some of these vaccines, they are even free of charge. The Cameroon government has actually made the vaccine to be free of charge. So all we need to do is just to rush to the nearby health center and then we get ourselves vaccinated. So the final word I'm saying here is that prevention remains the only way out. So prevention is better than cure.
Thank you so much for accepting my invitation on today's program.
Thank you so much, madam. The pleasure is mine.
Dr. MUVALA Marcel, Tradi medical practitioner. He works at the Padre Pio Hospital right here in the city of Douala. And thank you, ladies and gentlemen, for your keen attention. That's where I'll put a cap to today's edition of the program. You're in your health. Representation, I am Immaculate Fogwe. And I received technical assistance from Jonathan Babula and Louis Pego. From us to you over there, have a wonderful day. Bye-bye for now.